following is a primary consideration when performing a telehealth or a virtual visit for a patient education? So let's look at the choices. So option A says ensuring the patient has high-speed internet connection. And this would not be the right answer for two reasons. One, it's saying about the patient having high-speed internet connection. And the whole idea with telehealth is that we want it to be accessible to all types of patients. So if they don't have a high-speed internet connection, we don't want to make it where, oh, these patients can't be seen via telehealth. We want to be able to reach all types of patients regardless of what kind of internet they have at home. However, high-speed internet connection would be something that's important for maybe the office to have. So maybe when the provider's on telehealth, that's something they would want to ensure. So then we could encourage patients to continue using the service as needed. But this isn't something that we would need the patient to have on their end. Therefore, we could eliminate option A. Option B says making sure the patient is in a well-lit room. And again, this is something that maybe is more something a necessity for the provider to make sure that the patient has a good experience seeing them. The provider might ask the patient maybe to adjust the lighting if they want to be able to see something better, perhaps like a skin irritation, they want to be able to see it. But that wouldn't be really a primary consideration. That would maybe be something secondary that the provider would ask the patient, oh, could you just put a light over here? But this probably wouldn't be the main purpose that we're looking for right now with the telehealth visit. So we could eliminate option B. Option C says understanding the patient's learning style and adapting the education delivery method accordingly. And yes, that's something that is definitely important for the provider to do regardless if this is a telehealth visit or an in-person visit. Everybody maybe understands things in a different way. Maybe they want something demonstrated. Maybe they want to see reading materials to help them understand what's going on. And it's the job of the provider to be able to adapt to that so we could best meet the needs of our patients. So option C, we're going to go with. That looks like a good answer. But let's look at option D. This says ensuring the patient has the latest computer model. And option D is looking very similar to option A. This isn't really a necessity for us. We want to make sure we could see all our patients regardless of the type of computer that they have. So we can eliminate that. Also going back with options A and D, if there are any issues with computer and connection in terms of a telehealth visit, maybe they could be directed toward like the IT service desk for the network so they could help with any technical issues there. So we'll go with option C, understanding the patient's learning style.